Hello, my name is Juliet Rudder, and I am the Community Engagement and Outreach Coordinator for the Healthcare Coalition of Southern Oregon, and I run our local perinatal task forces. And this interview is for our virtual community baby shower that serves Douglas and Josephine counties. And here with me today is Elise, and we're going to talk about how to choose a pediatrician. So Elise, could you please introduce yourself and what you do?
Yeah, so my name is Elise Hansen, and I am the supervisor of UCAN's Nurse Home Visiting Program. So what that program is it's basically your own personal nurse. So it is a program that does home visits with pregnant women, babies 0 to 5, and then any kids with a special health need or health condition up to 21 years old. And how it works is that we get a referral either from you, your doctor, your OB, anyone in the community. And from there, we can set up home visits with you. We were doing virtual visits, obviously during COVID, but now we're able to go back and see in your home or meet you at a park or at a doctor's appointment. And from there, we just kind of provide like personalized health education to you or your child, weights and measurements, developmental screenings. We help with breastfeeding. All of our staff, our nurses are either they're at IBCLC or they're trained certified lactation counselors. And we'll provide, if your child has a special health need, provide education specific to that disease or disorder so that you know how to take care of your child best.
That's awesome.
Mhm.
In later videos, we're going to talk a bit more about like breastfeeding and all of that fun stuff, but super quick question, what is an IBCLC?
An IBCLC is an international board certified lactation consultant. So they can really deal with those. If you've seen your doctor, you've seen other people, and breastfeeding is still pretty difficult, they can handle those really tough challenges and help get things sorted.
That's super awesome. Thank you for that clarification.
Yeah.
So, what does a pediatrician do for an infant? Like, why are we concerned about this?
Yeah, so a pediatrician, that's who your child's going to see from 0 to 18 or 21. And they're going to provide all those well baby checks and well child checks that your child needs. So those kind of start out, 2 months, 4 months, 6 months, and on until yearly. And they will just do, when you see your pediatrician, they'll do a full physical health assessment of your child, make sure everything's on track developmentally, health wise, and then if there are any concerns, they can talk to you about those concerns. They can send you to specialists if you need to. They can diagnose and treat anything that comes up. If your kid gets sick, that's who you want to call because they're going to be able to help you out. Your pediatrician is also generally where you're going to go for those immunizations that your child needs to help prevent any diseases that they could get. And your pediatrician is also just a great resource. When you have kids are different and kids get sick and things come up, and they're your person to call when you have concerns or you're not quite sure what to do, or your child has the sniffles and you're like, this doesn't look like a normal cold. They're just your overall helpful resource for all things medical, behavioral, and mental health.
That is so awesome. And this has come up a couple of times in like previous posts and comments. But why do we care about well child checks?
So we care about well child checks because your child's health is like, it's so important, right? And the pediatrician is specifically trained to do those physical assessments and developmental assessments and make sure everything's on track. Because we as parents or we as people in the community, we can't always like tell those things, and that pediatrician really knows and can get your child's health where it needs to be. So taking your child to the doctor is so important, and they can do weights and measurements and make sure growth is on track, something that's super important to parents. So it's just super important.
Very cool. Thanks for that. So when should a parent start looking for a pediatrician?
So ideally, kind of anytime in pregnancy or about 3 months before your child is born. Um, so if if you have the time and ability to do it while you're still pregnant with that baby, that is the best time to do it. It can take a little bit of time to figure out who you want and where you want to go and what doctors can even see you. So starting that prenatally is the best. So then when that baby comes, because there's going to be so many appointments when baby comes, and there's going to be so many things that are exhausting you that you don't quite realize. So having that pediatrician already picked out and set up when you're pregnant is one less thing off your plate.
Very, very cool. So with all of that in mind, how does a parent choose a pediatrician?
Yeah, well, so there's several things you want to consider. The first thing that I always go to is check with your insurance. So if you have a private plan or if you have Oregon Health Plan, there's a couple ways you can look and see what doctors work with your insurance. So if you have a website that your insurance goes to, or you know who they are, give them a call and find out, hey, I'm looking for a pediatrician. Can you give me a list of who is in network? Because for certain insurances, some doctors aren't covered. So you want to make sure that they're part of your plan, because you don't want to go see them and then get slapped with a ton of extra fees because they weren't in network. And then if you're in Oregon Health Plan, and you're in Douglas County, there's or in Jackson and Josephine counties, there's the CCO should have a website, your Oregon Health Plan provider for your county, and they have a great little tool in there called Find My Provider, and you can search pediatricians and it'll tell you who in the county takes Oregon Health Plan and if they're even accepting patients. So that really helps you narrow down your list. So I always say check with your insurance first and find out. If you find a pediatrician that you want and you're not quite sure if they take them, give the office a call. Ask, hey, this is my insurance. Do you guys take this insurance? Would I be able to see you? That's a great place to start. The other thing I tell families is ask for recommendations. Ask your sister, your mom, ask your friends, ask your OB, who do they go see? Who do they like for their kids? I feel like a personal recommendation is just the best way you can go, because then you know, hey, my best friend went to this pediatrician and loved them. That's got to be pretty good. So definitely ask for recommendations. A couple other things to consider. Consider if you want, so there's, if you want a larger clinic, you want to go to a larger clinic that maybe has multiple pediatricians and maybe they also have a doctor that you can see or the whole family can go see. Sometimes that streamlines things. You can also see, oh, do I want to go to a smaller clinic that just has one or two doctors and they really just focus in on kids? Do I want to do that? You can look at offices and find out, give them a call and find out, what are their policies for hours? Do their office hours even work with your work schedule? Is that an office that you're going to be having to take time off work to go see? Or do they have extended hours after your normal, like 8 to 5? Some offices go to 6 o'clock so you could still get an appointment in. And then another thing to consider, there's many things. Another thing to consider is, what is their policy for getting your child in soon when your child's sick? So that's a great thing to ask when you're looking at pediatricians. You can ask the clinic, hey, so if my child's sick, what is your guys' time frame for getting them in? Do you set aside extra time at the end of the day? Because many clinics will set extra time at the end of the day for those spare appointments. So when little Timmy is sick and you call, they can get him in tomorrow at 4 o'clock. And you're not waiting a couple weeks to get your child in. So that is super important.
Yeah, that's something that I didn't think about at all. So like, yeah, that's awesome.
Mm-hmm. Yeah, so asking them what their policies are, asking them, some places have a nurse triage line or a nurse advice line, a lot of the clinics. So you can be like, hey, is this something? So if the doctor doesn't think my child needs to be seen, do you guys have a nurse advice line that I can call and they can help me out in the meantime? That's a great resource that clinics offer. So if that's something you're interested in, it's worth asking to see if the pediatrician you choose has that as available.
Wow, yeah, that is some awesome info. And for folks' edification, the CCO in Douglas County is Umpqua Health Alliance, and in Josephine County it is All Care. And yeah, Elise is absolutely right. Their websites are fantastic, and that tool is invaluable. So yes, for sure. So someone finds a pediatrician, and they're like, actually, this isn't entirely what I wanted or expected. How do they change to a different pediatrician?
Yeah, so I would suggest kind of going through a similar process that you went to when you found that first pediatrician. Call your insurance as well to make sure, call either Oregon Health Plan or your insurance, just to make sure they don't have any requirements on switching doctors. Sometimes your insurance is like, we don't want you to switch doctors more than one time a year, or so just make sure you're within the requirements. But it's usually a seamless process. Just find who you want to go to next, give that other office a call, and then you can start the new patient paperwork with that office. If you want to switch to a doctor in the same clinic, all it is, it's just a phone call saying, hey, I'd like to switch my care and I'd like to go see Dr. So-and-so instead. If you switch to an entirely different clinic, just make sure you tell the clinic that you're going to, the new pediatrician, hey, I used to see this person. Can you request my child's records so that you are up to date on all their care? But it should be a pretty easy process. And it happens. You think you have a really great fit, and then maybe something isn't quite working. You want to try someone else, and that's totally okay.
Very cool, very cool. So if a parent just doesn't have insurance, what do they do?
So first off, I just want to let any parents know that, don't have insurance. There's several resources out there where you can get signed up for insurance if you qualify. So there's several agencies, our local hospital, Aviva, Umpqua Health, even UCAN. They have people that will help sign you up for Oregon Health Plan, if you qualify for that. And then there's also a portal called the One Portal, um, and that will help sign you up for any services with the state of Oregon, including health insurance that you might qualify for. If you don't qualify for Oregon Health Plan and you still don't have insurance, there are several clinics that offer, it's called sliding scale discount or sliding scale fees. So if you find an office, make sure you call them and say, hey, I don't have insurance. I'd be interested in your sliding scale. And that just goes based on your income. You just pay a percentage of what it is based on your income. And most clinics have that option, and they will not turn you away for inability to pay. It's just important to ask them what their policies are and if they have that option.
Fantastic. Yeah, that's great. Those are all of the questions that I have drafted up for you. But if we haven't gotten to everyone's possible questions in this video, which is unlikely, how do they find out more about how to find a pediatrician?
There's lots of great websites. I love looking at the American Academy of Pediatrics. And then there's also a great website called Kelly Mom that should have some articles on that. So I would check out those websites.
Fantastic. Thank you
Yeah.
so much for your time, Elise. And also, if we haven't gotten to any of our viewers' questions, if you put those questions into the comments, I will work to get them answered by our last day of the baby shower on Friday. And hopefully we will get those questions answered for you. Alrighty. Well, I hope you have an awesome day, Elise, and an awesome day to you all, our viewers.
Thanks, Juliet.
All right, bye-bye.